If you've ever seen a hospital bill, I think we can all say, how the hell could this cost that much? $4,000 for a CT scan, $80 for an aspirin, $25,000 for a surgery that takes 2 hours. This is what most people don't realize. The prices that you see, they're basically fake. And the reason they're fake explains why healthcare keeps getting more and more expensive, even when government tries to make it affordable. Today I'm going to break down the third-party payer system and why it breaks price signals. Welcome back to Economics. Thank you for watching. Please like and subscribe if you get any value from these videos. Let's get right into it. In most markets, the buyer pays the seller. You buy groceries, you buy a car, you buy a laptop, you see the price, you decide if it's worth it. If it's too expensive, you walk away. That's a functioning price system. But healthcare works much differently. In healthcare, someone else pays. Insurance companies, employers, government programs like Medicaid and Medicare. That's called a third-party payer system. Patient consumes, provider delivers, a third party pays most of the bills. And when you separate the consumer from the price, you break that signal. In Austrian Economics, price signals communicate information. They tell producers what people value, what's scarce, and where resources should go. But if the patient isn't sensitive to price, and the provider knows the payment's coming from an insurer, prices stop coordinating behavior. They become strategic. This is where it gets interesting. Hospitals don't really expect to receive the full price of what they charge. So if a hospital lists its surgery at $30,000, they know that Medicare might reimburse them $12,000. Private insurer might negotiate $15,000. Medicaid might even pay less. So why charge $30,000 in the first place? Because the system is built on negotiated reimbursement percentages. Insurance companies don't negotiate based on real market prices. They negotiate based on discounts from inflated list prices. So the higher the sticker price, the stronger the hospital's negotiating position. This creates an arm race of inflated pricing. These aren't prices discovered by supply and demand. They're just accounting artifacts. And since patients rarely see them beforehand, there's no competitive pressure to bring the prices down. In the free market, price transparency is very normal. If you go online to buy a TV, you see dozens of prices instantly. Why doesn't this exist in healthcare? Because in a third-party payer system, the patient isn't the true consumer. The insurer is. Hospitals negotiate thousands of separate rates with different insurers. The same MRI can cost $500 for one insurer, $2,500 for another insurer, and maybe $4,000 for the uninsured. Prices vary widely because they're not responding to consumer demand. They're responding to contract structures. In healthcare, opacity is built into the model. This is the part that usually surprises people. If you ask for the cash price, it's often dramatically cheaper. Why? Because cash bypasses several things: insurance billing departments, coding bureaucracy, negotiation games, administrative overhead. When you pay cash, the hospital actually behaves like a normal business. A few examples would be imaging centers offering MRIs at $400 cash versus $3,000 billed to insurance. Surgery centers advertising bundled transparent prices for $5,000 to $8,000 for procedures that hospitals bill at $25,000 plus. Direct primary care membership for $70 to $100 instead of traditional billing. When the third party disappears, prices suddenly look like prices again. This isn't magic, it's just incentives. Now let's compare. Healthcare services largely insulated from insurance. LASIK eye surgery, cosmetic surgery, hearing aids, some dental services. All these areas have seen really great technological improvement, competitive advertising, price stabilization, or even decline relative to income. Now let's compare that to insurance-dominated services. Hospital stays, emergency room visits, complex surgeries, administrative costs, prescription drugs tied to reimbursement systems. All of these have consistently risen in cost. What's the difference? In the first category, consumers pay directly. They compare, providers compete. In the second, third parties dominate, prices are negotiated, and signals are distorted. From an Austrian perspective, this is not surprising at all. When you mute price signals, you mute coordination. When you insulate consumers from the cost, you distort the demand. And when you guarantee payment, you inflate supply pricing. In closing, healthcare is expensive not because doctors are evil, not because hospitals are greedy. It's because the system separates the consumers from the prices. And when prices stop communicating real information, markets stop functioning like markets. If we want affordability, love that word, we don't just need more coverage. We need functioning price signals. Thank you for watching Bear Economics. Please like and subscribe if you got some value from this. Drop a comment, and I will see you in the next video.